Hi, I'm Jodi Allen. I'm a speech and language therapist based at the National Hospital for Neurology in London. And about 7 or 8 years into my career as a hospital-based speech and language therapist, I found myself working in a multidisciplinary clinic for people with rare neuromuscular conditions. It was a respiratory and ventilation providing overnight respiratory support that helped people live longer. And seeing firsthand how our medical colleagues were translating the research into clinical practice was incredibly inspiring. And alongside these respiratory intervention, advances in cardiac care, steroid treatments, and now gene therapies, I've seen how they've transformed outcomes for many of these people. So over my 20-year career now, I've seen life expectancy for some of our patients move from some late teens up to almost 40 years for some of these groups. But as people live longer, we begin to see new or previously unrecognised challenges. And that kind of raised a really important question for me about how do we go about helping these people live longer, not just live longer, but also live well. And as an allied health professional, but specifically a speech and language therapist, I'm passionate about quality of life, particularly when it comes to eating, drinking, and communication. And the more I talk to patients, the more I realise these issues were deeply important to them and yet relatively unexplored in research as to how we go about helping them. I wanted to make sure that in the next 20 years, we weren't still approaching these challenges in exactly the same way. So together with the patients, I developed an NIHR application that would not only help me build my research skills, but also protect time outside my NHS role to give the work the attention that it deserved. And that journey led to an NIHR-funded Masters of Research, followed by some bridging funding, and then an NIHR-funded PhD, which I completed last summer. And the work's generated interest from patients, international colleagues, and the pharmaceutical industry. And as a frontline clinician, I could never really have imagined that these collaborations would happen. And working alongside this remarkable community of colleagues and patients, I feel like we're now making meaningful progress towards improving not just the length of life, but people living with rare conditions. And perhaps most importantly, the patients tell us they feel that healthcare professionals are walking alongside them on that journey. So looking back, I never really realised quite how rewarding building a clinical academic career would be. It's taken grit, determination, and at times some very long hours. Balancing clinical work, research, and life outside of work isn't always easy. But when you see the outputs of the work, the collaborations that it's created, and the meaningful improvements that it can bring to healthcare and patients' lives, it's absolutely worth it. And for me, being a clinical academic has provided an opportunity not only to ask important questions, but to be part of finding answers that can make a real difference.